Bismillahirrahmanirrahim. Quote of the day: what feels like the end is often the beginning. The topic of my presentation is Chikungunya fever. The learning outline of my presentation is epidemiological determinants, clinical feature, level of prevention, and recent advances. In the end of this presentation, the participant will able to describe about chikungunya fever, level of prevention, and its recent advances. First, we know about the short history of the chikungunya virus. Viral infection transmitted to humans by the bite of infected mosquito. It has become endemic in South and Central Asia. It caused numerous outbreaks in Africa and Southeastern Asia. Recent epidemics: extensive outbreak in the French territory of Reunion Island in the Indian Ocean occurred in 2005. After this outbreak, the disease has been reported in almost 60 countries. Chikungunya virus strain isolated in India during outbreak of 2004 to 2006. Global burden of this disease: Chick virus affects more than 1 million individuals across the globe. The dark green color show the area which are in these areas the chikungunya fever is endemic. The name is derived from Swahili chikungunya, meaning that which bends up. Manifest with crippling arthritic disease of sudden onset. Virus first isolated from the serum of a febrile human in Tanzania in 1953. Now we discuss the epidemiological determinants. Basically, there are three factors: agent factor, host factor, and environment factor. And now we discuss the agent factor. Two female mosquito species responsible to spread the chikungunya fever. One is Aedes aegypti and other is Aedes albopictus. Causative agent is a single standard RNA virus. It is arthropod-borne disease. This virus belongs to a family Togaviridae and genus Alphavirus. Now come towards the host factor. All ages are susceptible, mostly above 15 years, equal in both genders, but some recent studies show that the mosquito bite the female more than male. There is no as such lifelong immunity against chikungunya fever. Environment factor: humidity and moist conditions are favorable for the spread of this disease, and rainy season is also one of the prone factor in the spread of this disease or mosquito breeding areas. The season which are prone to develop this disease is July, August, and September, which is a monsoon season or a rainy season. The main reservoir of this disease is human, are the only reservoir, and the bite of mosquito is a source of infection. Human incubation period: it is 1 to 12 days, average 3 to 7 following bite of an infected mosquito. And mosquito incubation period: it is 7 to 10 days, and virus is present in infected state until 30 days or till the death of mosquito. How this disease is transmitted: mosquito bites and suck blood containing the virus from an infected person, and then a mosquito bite a healthy person, and then this disease is transmitted. Clinical feature: the main symptom of this disease is joint pain, which is present almost in 92% of cases. Other symptoms are fever, headache, myalgia, cutaneous manifestation, joint swelling, and digestive system. The most common complication of chikungunya fever is chronic arthritis, and some other complications are heart infection, covering of the brain, stroke and paralysis, severe large skin lesion, infection from mother to newborn during delivery, and sometimes death may also occur. Level of prevention. In primary level of prevention, we discuss two things: health promotion and specific protection. How we protect this from this disease: use seal window and proper door screens, apply mosquito repellent, wear long sleeve clothing, empty standing water from containers, old tire, cooler, pools and buckets. Protect yourself by using insect repellent. And which one of the insect repellents are used? Use Environmental Protection Agency registered insect repellent. Which one of the active ingredients below, when use is directed? EPA registered insect repellents are proven safe and effective even for pregnant and breastfeeding women. In specific protection, there are no as such role of vaccination developed against this disease. So there is no specific protection. And in secondary level of prevention, we discuss early diagnosis and prompt treatment. And for the early diagnosis of this disease, we isolate the virus with the help of viral culture. Real-time PCR test is used. IgM antibody test is doing, it is positive after 5th day of illness only. IgM antibody test. Symptomatic treatment are done in the patient. There is no specific treatment. Give antipyretics in case of fever, NSAIDs in case of pain. Give rest to the patient and plenty of fluids. This is a case definition of chikungunya fever. And what is this? Suspected cases are those: acute onset, high fever, 7 days of duration, severe headache, myalgia, severe arthralgia with or without rash. Probable case are those cases of chick virus, high vector density, presence of confirmed cases in area, and isolation of virus in early phase. Serological test for IgM antibody after 5th day of illness. Demonstration of 4-fold or greater rise in IgG antibodies in paired sera. WHO response. How WHO responds to chikungunya in the following ways: support countries in the confirmation of outbreak through its collaborating network of laboratories, provide technical support and guidance to country for the effective management of mosquito-borne disease outbreak, review the development of new tools including insecticide products and application technologies, formulating evidence-based strategies, policies and outbreak management plan, provide technical support and guidance to countries for the effective management of cases and outbreak, supporting countries to improve their reporting system, provide training on clinical management, diagnosis, and vector control at the regional level with some of its collaborating centers, publishing guidelines and handbooks on epidemiological surveillance, laboratory clinical cases, management, and vector control for member states. Basically, WHO encourages countries to develop and maintain the capacity to detect and confirm cases, manage patient, and implement social communication strategies to reduce the presence of mosquito vector. Chikungunya virus is a recent introduction to the America when it is first reported case of local transmission is occurring in 2013. What are the status of chikungunya fever in Pakistan? There is also some cases reported in Pakistan during 2016 and 2017, and the mostly cases are reported in the Sindh province. Emergence of chikungunya virus in Pakistan in 2016 and 2017. Almost 584 patients are reported during this. Chikungunya fever alert is a message which is given by Aga Khan University. Avoid mosquito bites. Who is at risk? Adults over 65 years of age, newborn infected around the time of birth, people with chronic medical condition like diabetes, heart failure, and blood pressure. These are the references of my presentation. Now let's come towards the MCQs. The agent of chikungunya fever is
Alpha.
right answer, single-stranded RNA virus. The incubation period of chikungunya virus in the mosquito is 5 to 7 days, 7 to 10, 10 to 12, or 14 to 15 days. B is correct answer, 7 to 10 days. The most common symptom of chikungunya fever is joint pain. What is the percentage of this symptom?
C.
C, 92%. When the first case of local transmission of chikungunya fever reported in America? 2010, 13, 14, or 16? Its correct answer is B, 2013. Most common complication of chikungunya fever is chronic arthritis, heart failure, stroke, paralysis. A, chronic arthritis. For the prevention from mosquito bite, which type of registered repellents are used? EPA registered. A, Environmental Protection Agency registered insect repellents are used. The IgM antibody titer positive in which day of illness?
C.
Virus is first isolated from human in 1952, 1953, 1954, 1955. 1953
B.
in Tanzania. B is correct answer. Emergence of chikungunya in Pakistan occurred in C is correct answer, 2016-17. How many dozen mosquito involved in chikungunya fever? 2 is correct answer. 2 species of female mosquitoes are involved. This is the key of MCQ. Thank you.
Thank you, Dr. Naida, for a wonderful presentation. Chikungunya is an Aedes mosquito-borne disease that causes severe joint pain and fever. It is an RNA virus. The word chikungunya is derived from language of southern Tanzania and means to bend, which describes the stooped appearance of the sufferers with joint pain. Discussing the global prevalence, over 2 million cases have been reported since 2005, mainly in Africa and Asia. For control of this disease, vector control efforts can be combined with dengue control efforts, as both of them have same vector, which is the Aedes mosquito. I would like to ask that how the diagnosis of this disease is done. Anyone from the class?
The diagnosis of this disease is mainly
PCR.
done by test, real-time PCR, virus isolation, and IgM antibody titer will
And in
done.
real time PCR IgG level. IgM.
IgM.
Antibody test is done, PCR is done, and virus isolation can be done, but that's expensive. The next question is, why do female Aedes mosquitoes bite more than male Aedes mosquitoes?
Because it needs blood for its reproduction.
Yes, because females they need blood only for ovulation. Thank you very much. Any questions from the class?
No. Thank you.